السلام عليكم أعزائي الطلبة ورحمة الله وبركاته. أسعد الله أوقاتكم وأمنياتي لكم بالصحة والسعادة الدائمة. Today we talk about hydatid disease. Definition: it is a cystic disease caused by larval stage of Echinococcus granulosus and Echinococcus multilocularis mainly. The Pathophysiologically speaking, the life cycle of this parasite have two hosts. One of them is intermediate host, which is the sheep, and the other is the definitive host, which is mainly dog. So what we mean by the intermediate host, that the parasite live the part of its life, the larval stage, and the definitive host, the complete maturation of the parasite completed in the dog intestine, and then can secrete and produce eggs. So this is the egg of the hydatid disease, Echinococcus granulosus. What's the role of the human being in this life cycle? How the disease and how the parasite infest the human being? The human being is an accidental host and is a dead end. يعني ما له علاقة بالموضوع. Unfortunately, he gave the disease. جايته تايهة بشكل عام. I mean the human being infested by taking or ingestion of the infected or contaminated grass or vegetable, or in contact with the infected animal or contact with the soil. So this cycle can be prevented. يعني it is a preventable disease by good washing and personal hygiene, by good washing of the vegetable that may be infected. So it is a preventable disease and can be decreased. Usually the disease is a common disease in Middle East, Iraq, Iran, Pakistan, and in this area. Now it is decreasing due to early diagnosis and good health service and early prevention of the disease. So if the disease, if the egg secreted contaminate the grass ingested by a human being, it will hatch by the effect of hydrochloric acid and other gastric juice and producing an embryo. Embryo penetrate the mucosal layer of the stomach, enter the portal venous system, and go for the first station, which is the liver. It is a preferable place. There it will either proliferate and form a hydatid cyst, or may bypass the liver and go for other places, the lung, the brain, the spleen, intestine, and everywhere. can infest any site except the nail and the hair, which is a vascular structure. So can occur everywhere, anywhere, but the best place is the liver. In liver, it will proliferate, form a germ layer, and this is the germinal layer organized in this form to secrete both the brood capsule and protocolysis and outer layer, which is the ectocyst. So these are the layer, ecto and endocyst, which is the germinal layer that form the both layer, the daughter cyst and the ectocyst. The ectocyst is a lamellated layer, not cellular, whitish milky in color, dissectable, adhere to the surface by the effect of the intracellular pressure, which is about 300 cc water. Destruction of these protocolysis and daughter cyst with the fluid called hydrated sand. Reaction of the tissue of the body to the cyst will lead to formation of pericyst. So pericyst is not a part of the layer of the cyst. It is a fibroblast with the vascularization of the new vascularization of the area to prevent the extension of the cyst, which is usually increase in size 1 to 2 centimeter according to the site and to the species annually. The human being called a dead end mean there is no completion of the life cycle of the hydrated because the cadaver is not eaten by the dog. So the end of life cycle of the parasite will end in human being, and it is preventable disease also. Presentation or clinical manifestation of disease. Either the disease discovered accidentally by investigation for other cause, ultrasound or CT scan or other modality, the human being come for other purpose, for other disease, for other complaint, and can be discovered for accidentally. So it is either symptomless or come as a mass, either painful or painless, or sometimes jaundice due to obstruction of the common bile duct extraneurally or intraneurally by rupture, or rupture and leak, this will lead to the anaphylactic shock, and if it is occur intraperitoneally, it will lead to the peritonism, and the patient come in as emergency condition, or can, if it is rupture in other site, ureteric obstruction. If it's in ureter, this is the typical presentation of anaphylactic shock due to immunological reaction for the hydatid sand of the hydatid cyst. Complication of leak or rupture into the peritoneal cavity, anaphylactic shock. In CBD, cholangitis, pancreatitis, or jaundice. In lung, expectoration of grape skin-like sputum, or in GIT also hemoptysis of a skinny grape or secreted in feces. In pelvis, maybe lead to the ureteric obstruction due to either rupture or extramural compression. Diagnostic tool start with the symbol by complete blood count. This is an overt eosinophilia, and chest X-ray will show different stage and type of and structure of hydatid cyst. Ultrasound, easy, available modality, and non-invasive, and can discover the cystic lesion and its site. CT to confirm, and MRI, Casoni test, and other immunological tests can be also used. Here, different picture showing the hydatid cyst of the liver and elsewhere. Treatment. Usually, the treatment starts with preparation of the patient if it is elective case by doing complete blood count, urea, creatinine, like other any surgery, and preparation of blood, and chest X-ray is mandatory if it is hydatid of the abdomen of liver or elsewhere, because maybe concomitant presence of disease. So to avoid rupture during anesthesia of intrathoracic hydatid cyst, we have to do chest X-ray. Is mandatory. Treatment is either surgical or medical treatment. Surgical treatment, open surgery or laparoscopy, or medical or hair, which is percutaneous aspiration, infusion, and re-aspiration of the cyst. In open surgery, after preparation, consent, and exploration of the hydatid cyst, walling off the site by bark, which is soaked by scolicidal agent, which is usually and commonly used. Normal saline hypertonic 20%, and 10% maybe Hibicane. Some other used scolicidal agent like formalin is a toxic and maybe danger side effect, like sclerosing cholangitis is now forbidden. And then opening the cyst after aspiration and injection of the scolicidal agent, and left for a while, about 7 to 10 minutes to act on the broad capsule and on the scoliosis as scolicidal to decrease the rate of recurrence, and the package also to decrease the rate of leakage and recurrence of the disease, which is the main disadvantage and complication of the surgery of this disease. And then either complete excision or cystectomy by inoculation of the cyst, ecto and other content, or by doing radical surgery, pericystectomy or partial hepatectomy. The cavity either drained using a drain tube or can be obliterated by using a omental flap. To prevent the residual abscess or residual effusion of the fluid. Laparoscopic modality also tried in certain places in accessible cysts and have the advantage of minimally invasive and feasibility in some cases. Other medical treatment, usually the surgical treatment, if it is elective, preceded by a course of albendazole and praziquantel administered for 2 weeks to decrease the rate of recurrence, and post-operatively also given for 2 weeks as a scolicidal and germicidal effect. Medical treatment can be used in cases where the cyst is very small, cannot be seen by the surgeon or by the naked eye, so it is difficult to explore, or multiplicity or inaccessible disease, or the patient refuse the surgery, or unfit, or failure of surgical treatment, recurrent disease, so can be used albendazole and praziquantel for 2 weeks and albendazole for 3 to 12 months can be given in per kg and interval of 2 weeks between month and other as a rest. Successful treatment indicator regression of the cyst. The cyst will be decreased in size or change in consistency of the fluid, or calcification. Calcification means death of the cyst. Concerning the pairs, mean percutaneous aspiration, injection, and re-aspiration of the cyst. Also, used, but has some disadvantage like spillage, which is also present in case of open and laparoscopic surgery can occur. Urticaria due to inflammatory reaction, abscess, residual abscess, and recurrence of the cyst, or biliary fistula or bleeding, which is can occur in other type of surgery. Thank you for watching and listening. أنا أعطيت المحاضرة بهذه الصيغة تسجيل، كون الإنترنت بشكل عام ضعيف النت، بالإمكان التواصل معي عن طريق الإنستغرام. هذا رقمي بكل الابليكيشن. For any question or comment you can ask through this facility. Thank you so much.